can. All right.
There it is.
Hey, everybody. Thank you for being patient. I have had some fun technical things. It's been a good day and working from home. If you have grandchildren or nieces and nephews, or maybe your own children that are doing school online, you've probably dealt with some of these technical things as well as the teachers are. Oh, I'm still getting through it. So again, thank you for being patient. And I'm very excited to talk to you today about the VA and Medicare. And with that, I'm going to give some information to some of um, the most common questions that we get and how to understand. Because as I said before, we simply speak Medicare. And in just a minute, I'm going to put a phone number up. That's the number to reach any of our trusted coaches and licensed agents. So if you have questions or you need information, you have a number to call. So I'll be putting that up in just a few minutes. But before I get started, the reason why this is such a big conversation, or I'm excited to present this, is because one, there's a lot of confusion about what the VA is in regard to my Medicare services, and do I even have to have it? And we're going to address that. And so, with that, I just want to say, you know, the principal and owner of Trusted Senior Specialist himself is a veteran. And we do have veterans that work in our office. Either they are retired veterans, and we have some who are in the reserves. It's an honor to be able to work next to someone who has selfishly and selfishly given them themselves, their time, and the risks to serve our country and to be there for us. And many of you, I are either a veteran or in the reserves, retired, or you may have been married, or you have a family member who is a veteran. And so I just want to start with saying thank you for your time, and thank you for your service. It never goes disregarded, not with any of us. So that's why this is a very important subject for us. So let's get moving. Medicare and veterans. So who uses the VA? Well, we know the VA does have what we call a priority list. So when someone has either an illness, a disease, a disorder, something that has inflicted their body, or other circumstances, it even could be physiological, it could be psychological. If it has impacted them, there's a priority list. We understand this. And if you aren't familiar with the priority list, I encourage you to call and speak with one of our coaches, and we're going to get you that information. It's not our information. We actually got it from Veterans Affairs. We don't create that, but it'll explain the priority list. And there is a qualification we understand that someone would go through in order to receive medical services through the VA, and it's based on certain criteria. So if you don't have that information, or if you are married to a veteran and you're not sure how that works, we'll get you that information. All you have to do is call. And again, I'll get that number for you guys in just a little bit. And as I said, you can always contact Veterans Affairs or go to the Veterans Affairs website and you can download that, but we can easily get that over to you. Now, here is what I want to say about Medicare and veterans. And you're going to have to work with me on the technology because I do have the title up and I'm going to change it in just a minute. So give me a second. Okay. I think it works. Am I required to apply for Medicare? So, no, you're not required to have Medicare. Actually, nobody's required to have it. I'm not required to have it. Well, let's pretend I'm 65, okay? But no one is required to have Medicare. It is a health insurance, and it is a federal insurance, but the VA is a federal entity. And so it's already funded to give services to those who are qualified to receive it based on their service. It is already, those funds are there, okay? But to say that you're required to have it, the answer is no. But my question to you would be, should I apply for it anyway? Well, I'm going to say yes. And even the VA says you should have Medicare Part A and Medicare Part B coverage because the VA is not a health insurance plan, which means if you're a veteran and you're feeling sick and you go to the doctor, that's not a veteran doctor, all right, what we call a civilian doctor, that service may not be paid for. Okay, it really depends on the circumstances, or if you're qualifying under the new rules that were passed recently in this current administration, where you have access to care if you live so many miles from the VA, or if the appointment is too far out for what your need is, then you can see a civilian doctor. So I'm not going into that. I'm just saying, if you decide from within those qualifications, you decide to go to a civilian doctor and those qualifications didn't apply to the circumstance, and you receive services outside of the VA without Medicare A and B, do you know what your liability is for that service? Exactly, 100%, because you don't have Medicare. Now, you don't have to have Medicare, but is it recommended? Yes, it's recommended by the VA and it's recommended by most people. And the reason is, and I'm going to give you a true story. I do have a family member, without giving away too much information, who is a Vietnam veteran, and he has been disabled since day one. Okay, since day one, when he returned from Vietnam, he has been receiving VA services. Well, he kind of had a bit of an accident. He got into a physical health accident, and he was rushed into the local hospital. Okay, he goes to the VA, right? He gets treatments for the VA for his lungs, but this wasn't his lungs, and this was an emergency situation. He went to another hospital, and he was billed 100% because he didn't have Medicare, because he's always been part of the Veterans Affairs, and that bill was over $487,000. So was he responsible for the 20% that Medicare didn't cover, or was he responsible for 100%? Okay, remember I said he didn't have Medicare, right? Exactly. He was responsible for all 100% of the services because he didn't have any other insurance. And it wasn't something related to the VA or his health or anything related to the services he did in Vietnam in order for that procedure or those procedures and that whole event to be covered by the VA. So, should you have Medicare? It's highly recommended. Now, let's go to the next question that we have on our agenda today. So, what if I use the VA services? Okay, yes, that's a great question. If, just like him, you're using the VA for the services they're there to provide that are due to your time served, or for what you served for, and your related injuries or non-injuries, but related to time served in the military, and then also for the rest of the priority. But do you have, what if I get my Medicare there? What if I do get my Medicare there? Do I use my Medicare at the VA? And I'm going to address that in a minute. So what if you use VA services? Again, having Medicare A and B is highly recommended, but you're not going to use your Medicare at the VA. And I'll explain why in a couple more questions from here. But having Medicare does not interfere with your services you received from the VA. So let me clear that up. If you are using the Veterans Affairs for your healthcare services and you get Medicare, it will not interrupt your services you're receiving. It has nothing to do with it. They're not going to say, well, hey, buddy, you got Medicare. Hey, ma'am, you applied for Medicare. You don't need to see us anymore. You can go get your healthcare anywhere you want. It doesn't work like that. You're still going to continue receiving your benefits there. And so, again, those benefits may be different. You may receive services here and you can receive services there. I just always think about an earache. Earache, oh, I mean, it's like tooth pain. When you have earache, everything is ringing. Your head hurts. It's pain. It runs through the back of your neck. It can hurt underneath the arm. It is so painful. And if I have to go and schedule an appointment to see somebody tomorrow or in 3 days from now, or I have to sit and wait and that pain is intensifying, I get irritated. Very few things irritate me. That irritates me because I'm in pain. And when do we get mostly irritated? We're hot. For some of you, hungry, lack of sleep, and toothache pain and earache pain. Those two are immense. So I would like to know that if I do have earache, or if I have something that is affecting my eye and it's turning red and it's tearing and it's just very irritated, I maybe have a foreign object in it. I can run to the doctor real quick around the corner and get this taken care of right now. I don't have to wait. I don't have to wait on an appointment. And I know that I'm not going to be 100% responsible for that visit. That's the key. I'm not 100% responsible for that visit. I have something to kind of cushion me, right? The whole game when it comes to Medicare or any kind of health plan is what? To save money. That's the game behind it all. What's in it for us? We save money. Okay. Now, let's say that you go ahead and you follow the recommendations of the VA, and we can send you that information. And again, I'll get that number up for you guys in a minute. But if I have my Medicare and I go to the VA and there's some out-of-pocket expenses, can the VA bill Medicare for my co-insurance or for my co-pays? And the answer to that is no. No. I guess it's considered double dipping. I mean, I haven't heard anybody from the VA, tell me, yeah, no way, that's double dipping. But from what I understand, they can't receive the federal funds twice. So the VA is already federally funded. So when you go to the VA, your services are paid for your time served. You're taken care of. But if you have any co-insurance or co-pay, that's going to be the responsibility that you have. And if you do have another private health insurance, maybe a spouse's group plan, that can be accepted at the VA. That's something that I'm not too familiar with because that's not really, well, I'm just not familiar with it, all right? But for Medicare, no, the VA cannot bill the difference or any co-insurance or co-pays to Medicare. The VA cannot bill to Medicare. And that's going to make sense to you when I talk about TRICARE at the very end of this video. So can the VA bill Medicare for my co-insurance or my co-pay? The answer is no. Whatever services you receive at the VA is exclusive to the VA. Now, can my Medicare, right? If I have Medicare and we know Medicare pays 80% of approved services, right? Can I send the other 20% to the VA? And the answer to that is, again, no. You cannot send the VA a bill for services you received outside. Now, most of you guys know that, but we all have questions, and I want to be sure that we understand that if you do have a question, then we want to make sure that you don't feel like you need to hide that question, okay? And so never be afraid to ask questions. In fact, if you have questions right now, stream them in, test my knowledge, right? I love live questions. So if you have a question, I can see your questions. Hopefully I will have an answer, but I know this. If I don't have an answer, I will get it to you. But I would like for you to test my knowledge. So let's wrap up this question. Can the VA bill my Medicare? The answer is they cannot bill Medicare for any leftover expenses. If you have a group health plan or you're on a spouse's plan, I believe that is a yes. But when it comes to Medicare, the answer is no. And if you have Medicare and you're using a civilian doctor, you cannot bill the 20% to the VA. They're not going to pick that up for you. That's no. Okay, so let's go to our next question. I think I've already, can I use a Medicare health plan at the VA? So it goes back to the same thing we just spoke about a minute ago. With a health plan, if you have a Medicare supplement plan, right? That is called a Medigap plan. So you have Medicare A and you have Medicare B. You have to have both in order to have a supplement plan. So what happens is if you go to a standard doctor, civilian doctor, they're going to bill Medicare A and they're going to bill, Medicare A and B, whatever. They're going to bill Medicare first. And then the other 20% will be invoiced back to the physician's office. And then they send the remaining of that bill to your private health insurance. So can I use my health plan at the VA? No, because they're still billing Medicare first. Well, what about one of those Advantage plans? I heard those are called Medicare replacement plans, right? A Medicare replacement plan just means it replaces the billing to Medicare, but because their funds are still through Medicare anyway, right? They just replace the billing. They cover the parts A and B or let me see how I can explain this. Medicare Advantage plans do not pay after Medicare pays. They pay instead of Medicare. So they pay for Medicare A and B services. Instead of a physician billing Medicare, they just bill the private insurance plan that received money from Medicare. So again, if you even have a Medicare Advantage plan, Medicare health plan, you cannot use that at the VA either because it's still funds coming in through Medicare. So I hope that made sense to you. But again, we're always here to answer your questions. So if you have a question or a comment and you want that clarified, call me. But it just comes down to this. Your VA medical costs are isolated to the VA and your Medicare is separate. Am I required to have Medicare if I have VA services? No. Should I have it? We highly recommend it. And like I said, my family member who doesn't have, or at that time, he does now, but at that time, he's used the VA since he got out of Vietnam, and he just turned 65 3 years ago. That's a long time. He found no need in having Medicare. He ended up in a situation 100% responsibility because he didn't have another insurance, and his health injuries had nothing to do with his service and time served. So he was 100% responsible, and you don't want to end up in that situation. So let's go to this next question. What about, oh, it disappeared. Well, let me see if I can fix it because I'm having fun with my technology anyway. Nope. Well, I was trying to ask you, what about my prescriptions? They disappeared. Okay, what about my prescriptions? So, a lot of people who are using Veterans Affairs, not only are they getting healthcare, they're getting the prescriptions. And so, here's what we recommend. First, we recommend, oh, there, it's scrolling. Yay! We recommend that, yes, you get Medicare A and B. We will tell you you should have a secondary plan, all right? Because 80%, 20%. Well, let's just pretend for a second. Let me do something for you guys, because I promised you that I would have a phone number, and I want to get that up for you guys because I know some of you have questions and you're not typing them in. So I'm going to get that for you. But let's think about this. The family member that didn't have Medicare or any other coverage has been going to the VA since the Vietnam War. As soon as he got out, he was 100% disabled. He had an incident, and he was responsible 100% because he did not have the any kind of health coverage, including Medicare. Let's say he did. Let's turn back time a little bit. $480,000. What is 20% of that? 10% of 480,000. 10% is 40,400, right? 40,800. 40,800 is 10%. So 20% of that would have been somewhere around $90,000. So about almost 100,000. Okay. So had he had Medicare A and B with his incident, he would have been responsible for 20%. So 480,000, 20% is right about 90 something thousand dollars out of pocket. Still a good chunk of change, right? So I would suggest that don't stop at getting Medicare A and B, but select a Medicare health plan. Now, the great thing is that there are health plans that won't interfere with your services at the VA, because we understand that most prescriptions at the VA are free or very low cost. Someone's asking, would it be the same with the other plans that you are talking about? Okay, if you are currently receiving prescriptions at the VA, there are health plans. First, you have to have your Medicare A and B, but there are health plans that will say, we don't provide the drug coverage. You can continue getting your prescriptions at the VA because maybe they're very low cost and very free. And you don't need to change what you're doing with the VA. Keep your relationship with that doctor. That's great. And we won't interfere with your prescription drug coverage. So we're going to give you a different incentive. And I promise you this, you'll like that incentive. Now, I don't have permission to go over what that incentive is. So let me recap what I'm telling you so it makes sense. You're not required to have Medicare A and B if you use VA services, but we do encourage it, and the VA encourages it because you just never know. So let's say you have Medicare A and B. With the A and B only, you have a 20% responsibility for services outside the VA. And we know that also the VA does not allow you to balance bill, which means you can't get your services at the VA and bill the difference to Medicare. So you're going to see the doctor, go to a hospital outside of the VA. You're responsible for 20%. We encourage that you have a secondary plan. Now, there are particular plans designed for veterans that gives benefits for dental care, for vision care. Maybe you can go to the local gym or YMCA, get your stretches in, or a CrossFit class. I mean, these plans are are pretty extreme when it comes to the kinds of benefits they offer, but there's a huge incentive for veterans if they choose a plan that doesn't include prescription drugs. Now, I'm not recommending that plan for you. I'm just letting you know and to be aware to ask about it. What are one of those plans that veterans would want to receive if it doesn't include drugs? How would that be a benefit to me? Because I'm happy with my prescription service at the VA. They mail it to me, or it gives me a chance to go down there and see my friends and, whatever it is you do at the VA. That's what I'm saying. Oh, I want to stop for a second. I am going to do something, and that is going to be, I'm going to try. I want to. Give me just a second. No, that's not it. Well, okay. I'm going to try one more time. I want to get this phone number out to you guys. Let's see. I'll do it in a minute. Okay, because I'm still testing myself of what I can do with technology. I know Medicare. Okay, I know Medicare, but technology is, I'm learning it. Okay, so if you are okay with not getting your prescriptions at the VA, that's cool too, because you'll just choose a plan that does have prescription drug coverage, and you will get your prescriptions from the civilian doctor at the local pharmacy, and the plan will cover it. But if you choose a plan that does not have drug coverage, and you have a doctor outside of the VA prescribe you something, okay, let's say if you go to the doctor and you do have an earache, but you also have something else going on, and they're like, hey, we notice your blood pressure is a little high, we're going to prescribe you some of this, and it's a civilian doctor, you're not going to fill that prescription at the VA, because that's a non-VA doctor. So you got to understand that. So going back to the VA doctor, if you get a VA doctor who prescribes you medications, that's going to be filled at the VA or by mail from the VA, not related to your Medicare health plan. If you go to a civilian doctor and he prescribes you high blood pressure medication because you went in for an earache and it was caused by your high blood pressure and other ailments, and he prescribed you something, you're not going to fill that at the VA. You're going to fill it under the health plan. But if you chose a health plan that did not have drug coverage, you may need to pick up the phone and do a teledoc thing with your veterans doctor, and then hopefully by then that VA doctor can prescribe you the medication at the VA, and there's no cost to you for that. Okay, so when it comes to veterans choosing a health plan, you can choose a plan without drug coverage, and there's a big incentive for you for those types of plans. And there are still incentives for those that do have prescription drugs. So it really comes down to you. Do you prefer to get your prescriptions from the VA, or do you not really care? But what if you were 65 4 or 5 years ago? Okay, I didn't put that in one of my things. But let me talk about that for just a minute. What if you turned 65 already? Let's say you turned 65 2 years ago and you didn't have Medicare A and B. Well, the rules with Medicare is that if you don't get Medicare A, you're normally okay because it's premium free, but there can be a penalty associated with that. But if you especially didn't get Medicare Part B, when you were eligible, you had that 7-month window, and you may not even received any information about it. I don't know. Medicare is going to start sending these notifications out to people turning 65 now. It's called the Bennies Act. That's new. It's part of the new fast movement with what's happening with the changes in Medicare under the new administration or the current administration. The Bennies Act will send a letter to you if you're turning 65 saying, hey, you have options, here's what you need to know. They didn't do that a few years ago. So a lot of the people we speak with are like, I had no idea. I didn't know this was a thing. And that's why we do what we do. Okay, we have these videos, we have these chat rooms, we have these conversations because we know that you may not have been told something. So if you turned 65 2-3 years ago and you didn't get Medicare, you will have a Part B penalty. Well, how much is the penalty? Well, it's the current year's premium. Right now, the Part B premium is 144.60, and they tack on 10% on top of that, and that's per month. So that penalty never goes away. But again, there may be a way to get out of that penalty, but you have to talk to one of our trusted agents. So since I can't do the crawly thingy that I'm trying to do, so I'm just really trying. What I'm going to do, see, and that's saying ask about creditable coverage, but that's not what I want to do. Um, Let me see if I can do another one. Hold on. I'm going to try this. I want to get that number to you guys, and then I'm going to continue. No, still didn't do it. Okay. All right. Oh, maybe I can do it this way. Just give me a second. Like I said, I'm really trying to get this going. Um, and someone's telling me, I know, I saw. I just want to do it here. Let me try this. As I said, I like learning these things too because I want to do better. All right, I don't want to stop talking too much. Okay. Oh, I did it, but there should be dashes in there, but you have the number. It's 1-877-960-3354. I put that there because it's important that if you have questions, you talk to one of our agents. If you want the information about the priority list and the VA, I want you to ask us. It does come from the Veterans Affairs website. We don't create that information, but we can get it to you quickly versus you trying to navigate or call or whatever. Okay, so let's go back to this VA not having Medicare. So if you are going to the VA and you have been going to the VA, you already turned 65 2-3 years ago, and you're just now getting into Medicare because you don't want to be responsible for 100% of anything, right? That's just giving the money back to the government if you think about it. Oh, gee, you go to the Veterans Affairs, you receive services for health benefits and services you deserve, but then something happens outside of VA approved services, and then you got to pay 100% into the medical. Wow, if you think about it. Okay, let's get our Medicare A and B. So let's say that you do have that penalty, that Part B penalty. There are ways of getting that taken care of or getting around it, especially it's based on means, which is income. We'll get that information to you. So don't be afraid of premium ever. Talk to one of us. Don't be afraid of a penalty if you think you've already have qualified for a penalty. And we say qualified because you're qualified for it if you didn't have Medicare and you get it late in the game. There's still ways that we can talk around that. But for your prescription drug coverage, because Medicare Part B and Medicare Part D for drugs both carry penalties, which means if you don't get it and apply for when you're first eligible, then you'll be penalized once you do get it. It's just like paying a late fee, but it's on every premium that you pay towards Part B and Part D. But with the VA prescription service, your Medicare Part D is considered creditable coverage. Creditable coverage means it's as good as Medicare. So the VA's prescription program is as good as Medicare's prescription program. So if you don't have Medicare and you're worried about a Part D penalty, don't, because you won't have one for Part D for drugs, because the VA is considered credible because their prescription service is as good as Medicare. So again, if you have questions and you haven't applied for Medicare yet, we want you to talk to one of us because we can walk you through that. We may have a way of getting it around, going around certain things. But how about those guys who have TRICARE, or those ladies that have TRICARE? We know when you are serving, you have TRICARE, or before you're 65, your insurance is called TRICARE. When you turn 65, it changes the name and becomes TRICARE for life. Okay, so how does that tie into Medicare, and how does that tie into the VA? TRICARE for life acts exactly like a Medicare supplement if you think about it. When you go from TRICARE to TRICARE for life, you have to have Medicare A and B. You have to have Medicare A and B. So let me ask you a question. Here's a teaser. Going back to an earlier part of what I was talking about, can the VA bill Medicare? No, right? It can't bill Medicare because it's a federally funded organization, so it cannot bill Medicare. So if you have to have Medicare A and B in order to have TRICARE, and TRICARE pays after Medicare does, you would not use the TRICARE plan at the VA. So if you have TRICARE, you're not going to use it at the VA. You're only going to use that outside of the VA. So it acts just like a Medicare supplement plan. So yes, you have to have Medicare A and B in order for you to have TRICARE for life because it pays secondary. Now, question, should you have anything else if you have TRICARE for life? Well, believe it or not, we do have a select few of people, a select few veterans who truly understand how certain plans work, who will say, I want to get that plan too. I already have Medicare. This plan is very affordable, not the TRICARE plan, the other plan is very affordable. I want to layer my coverages. You can absolutely do that. Now, most will get one. We will always tell you, do not get one of those other plans that has prescription drug coverage, because your TRICARE for life does not have what we call a donut hole, which means once you reach a certain out-of-pocket expenses to Medicare for prescription drugs, then you have to pay an X amount towards that prescription. So if you have questions about the donut hole, I don't want to overwhelm you guys. Like I say, please call and talk to us. But the TRICARE for life plans do not have what they call a gap, or where you have to pay more for your medication throughout the year versus other times because you met Medicare's limit on how much they will pay towards your prescription. So if someone on TRICARE for life wanted one of these other plans that offers those gym memberships and acupuncture or dental care, we would tell you, you need to get one that does not have drug coverage. That needs to stay with your TRICARE for life. Now, what we do for most of our folks on TRICARE for life is, we know that it does have dental care, but it's not like a big bang kind of plan. So we do have dental health insurance for people on TRICARE, and that's normally what they get, or they get the hospital indemnity or both, because there is some out-of-pocket expenses even with TRICARE for life. So those hospital indemnity plans and those dental plans are really popular for our TRICARE people that give us a call. But you're not going to use your TRICARE at the VA. And if you have TRICARE for life, you do not need to have another plan. But like I said, if you want some of those other advantage type plan benefits, don't bother with getting a prescription plan with one of those. You don't want that. Keep your TRICARE for life prescription coverage, but you could stack some of those other plans in order to enhance. And again, we usually just recommend getting a dental plan, a true dental insurance plan, the hospital indemnities. Some cases, people will get a cancer plan because it pays a lump sum. That's very popular. So I want to go back to the beginning just for a quick minute, because it's very important that I don't overwhelm you guys with a lot of information. And we spoke about quite a few things. So, and I went through it rather quickly, so I just want to be sure. Okay. So as a recap, and I'm going to put up my agenda so I can make sure that I do this right. First and foremost, again, if you're a veteran, if you're a family member of a veteran, if you are married or have been married to a veteran, thank you for giving them the time to give the service. And if you are the veteran, thank you for your service. It's a big deal. And I don't cry at funerals, but patriotism kills me every time. If I see a parade go by with flags or little kids and wagons, 1 year for July 4th, and I don't want to go too far off, but 1 year for July 4th, because on July 4th, I want to see the fireworks. I want to see them big, boom, bang. I've got to hear them. For New Year's, I'll go pop my own, right? We'll get our fireworks and we'll put on our own show. But I don't want to cry, but for July 4th, I got to watch these things and hear the music. And I get very excited. And 1 year, our daughters, we're in Houston, and they were in San Marcos going to college. And I said, hey, this town outside of Round Rock has an old fashioned parade, and they have parachuters, and man, best July 4th of my life. It was so exciting. They had the Old Town Parade, the little kids, the little things that they did with the ice creams, and they had this art show going on. It was on some kind of fairgrounds. They even had, oh my goodness, I don't want to go too far off, but I'm just so excited. They even had this real life uh, battle with, blanks, of course, and they were getting away. It was bank robbers, and these guys had fought in the war, but they came back and they became hometown heroes, and they stopped these bank robbers. And then they had the parachuters come down, and the fireworks show was amazing. I cried and boohooed the whole day. Okay. I don't cry at funerals because it's a fact of life, unfortunately. It's just something that we all have to process and go through. But boy, patriotism kills me every time. So when I talk to veterans, or I talk about your service, I talk about your time you spent, and the unselfishness you had for serving us, it really uh, hits home because it's a big deal. It's a big deal. Okay, so let me focus. Thank you. Let me focus. Medicare and veterans. If you are a veteran, the question was, am I required to apply for Medicare? The answer is no. You're not required to have it, not at all. But it is recommended not only by just the general public, health officials and doctors and hospitals. It's recommended by the VA. They tell you you should have it. Why? Because the Veterans Affairs is not an insurance program. So if for any reason you have something that cannot be treated at the VA, or if you cannot get into the VA for something that's very painful, like I said, an earache, or you have a foreign object in your eye, you fell and broke your elbow, right? Emergency service. It happens. Putting up those Christmas lights, you're going to go to a typical hospital or a typical doctor. You're going to be 100% responsible for that bill. 100%. That's a lot of money. Don't do it. So have your Medicare A and B. If you want to have some information on getting that Part B reduced, or help, especially if you're low income, there's a thing for that, and we want to talk to you about that. We want to tell you about that because it's not, no one talks about it. Well, we do. We want to get that out there for you. Okay, so if you use the VA services, we encourage you to continue using the VA services, but have Medicare A and B on the back end. Because again, if you have that broken elbow, you found water on your knee and you just want to get it looked at, you got a migraine that won't go away, maybe your blood pressure is going crazy, you're either going to sit in the doctor's office for a long period of time, or you have to wait a couple of weeks, or you could just get in quick if you have Medicare and you have a health plan, and you're not going to spend a lot out of the pocket. Can the VA bill Medicare? Can the VA bill Medicare for my co-insurance? The answer again is no. If you do have the VA services, if you qualify to receive the health services at the VA and you have Medicare, you will not send a bill to Medicare for any co-insurance or co-payment. The VA again is already receiving federal funds. They cannot receive Medicare funds. They cannot bill to Medicare. So at the end of the conversation, I had said, if you have TRICARE for life, you will not use that at the VA because it requires you to have Medicare. They bill Medicare first, and then TRICARE for life pays secondary. So you would never use TRICARE for life at the VA. Just if you have it, that way you know. If you have a spouse that receives that through you, they understand they're not going to use that at the VA. Can I use my Medicare health plan at the VA? Again, that is no. Why? Because the VA cannot bill Medicare. They cannot. So you can't use your health plan there either. What about my prescriptions? I'm going to go over this a little quickly again. If you are already receiving your prescriptions at the VA and you're happy with that, we're not going to interfere with that with having a Medicare health plan. And having Medicare does not interfere with what you receive at the VA. It's two separate entities. You get your VA services through your VA doctors, and then you get your health services at the other doctors. If your VA doctor prescribes medications, you're going to have those medications paid for by the VA. You're going to pick them up at the VA or have them mailed to you from the VA. Or you can choose to have some of those prescriptions, or all of your prescriptions, or no prescriptions. There's so many choices for veterans. If you get Medicare and you get a health plan, you can have prescription drugs that will be paid for through the plan, not the VA. If this doctor over here prescribes you something, you can't take that prescription to the VA or vice versa, right? They're two separate. Okay, the Nile, right? Was it the Nile? The Red Sea? The Red Sea, split it up. VA, Medicare civilian doctors. So if you get a prescription over here, the health plan will pay for it. Now, if you chose a plan that doesn't include prescriptions, that's okay. Talk to your VA doctor and say, hey, they diagnosed me with this. I want a second opinion. The VA doctor will prescribe it. It'll be paid for through the VA. There are incentives to veterans who get a plan that doesn't have prescription drugs, because some of those plans, if they're not spending the money on the Part D part, then they give you another incentive. But I can't go over those. We will give you that information when you call. I just can't because it's going into the benefits and you have to get all the approval to get that done. So it's like royalties in a way. So if you get your prescription drugs at the VA and you want to continue that, there's a program for you. If you don't get prescriptions at the VA, or if you do and you want to stop that, we have a program for that too. So either way, again, there's a lot of choices for our veterans, and that's a good thing because you deserve them. Now, let's go to the next one. Oh, again, the VA is considered creditable coverage, which means if you qualified for Medicare already and you forgot to enroll, or you didn't know you should, if you get Medicare A, B, and you get that drug coverage, you will not have to worry about a penalty because the VA is considered creditable coverage for prescription drugs, which means you won't have the penalty. And what is the penalty again? If you were qualified to enroll in Medicare A, B, and D, and you didn't do it when you were first eligible, there's a penalty involved, especially with Part B, medical, and Part D, drugs. But that one for drugs goes away, it drops off. Why? Because you had VA services. And so you're clean there. Creditable coverage, creditable just means it is as good as Medicare. And I already explained the TRICARE thing with you guys. So we do have a resource guide for you. We get it from the Veterans Affairs website. We can guide you to that and get you that information. And again, even the Medicare and You handbook that Social Security puts out talks directly to veterans about having Medicare coverage A and B, because let me just give you those numbers one more time. If you are a veteran and receiving services by the VA and something happens, you have an emergency, you're outside, not related to VA, not related to any time served in any of the military branches, something happens and you go to a typical hospital and you're treated, well, how much of that are you responsible for? 20%, 0%, or 100%? Exactly, 100%. That is why you are encouraged, not only by the VA, but Social Security has it in their Medicare and You handbook. And we also encourage you because I have a family member that went through the same thing, $480,000, 100%. If he had Medicare, he'd only be out $90,000. Guess what he has now? Yes, he has Medicare now, but at that time he didn't. And that's why we say it's better to do it early, do it right, and do it one time so you don't have to go through the penalties, you don't have to go through the hassle, and you know what you have is good. So if you have TRICARE, again, we don't encourage anyone with TRICARE for life to get to change that out and get any kind of Medicare plan, but we do have very few veterans who will say, yes, I want that plan that's built for veterans and kind of stack it into my TRICARE for life because I want to have those additional benefits I hear about, whether it be the acupuncture, the gym memberships, the vision care. Those are kind of stacked into plans designed for veterans. Yes, we can do that, but I will tell you now, do not get a plan that has prescription drug coverage included because your TRICARE for life has a better drug coverage than Medicare. Because why? You don't have a gap. You don't have what they call the donut hole. It's not part of TRICARE for life. So again, for our TRICARE for life folks, a lot of people who have TRICARE for life that we talk with, they typically opt for a dental insurance plan. Either a lot of them do like the cancer because it has a lump sum distribution at diagnosis just in case, and having cash on hand for experimental or for services outside of your choice of how you want to use that. But the hospital indemnity is pretty popular. But for our veterans using the VA services, those who do not have TRICARE for life, there are plans made for you. They're great plans, but we have to start at the starting point, and that is having original Medicare A and B. Don't leave yourself exposed to just that. There are great plans and incentives for you by many of the different carriers out there, and we encourage everyone to learn more about those. So in case that number is going too fast, it's in the chat. Give us a call. It is 1-877-960-3354. And this information is going to be available to you guys to watch again and again. Send questions, email, Let us know your thoughts. Let us know your experiences too. Tell us your story. Tell us your story. We love them. And I thank you guys for joining. And make sure that you're joining us for the next video. And I'm going to tell you what that is, because give me just a second. My memory is, oh boy, my memory goes very quickly. But I do have a new one coming up soon. Let me tell you what that is. I'm going to get these things written down so I can remember. I think it is next week. Well, yeah. Oh, in September, we're going to have some really good subjects to talk about. I'm excited for September, but let me tell you what we have coming up for the next video that we're going to do together. Give me just a second. Boy, I'm going to find it unless someone could tell me what it is faster. Give me just a second. Not finding it there. Goodness. Well, be on the lookout, because I can't remember what the topic's going to be, but it is going to be good. That's all I could say. And in September, coming up in September, we're going to have a lot of really good topics. We are going to talk about, I'm going to give it away. We're going to talk about really understanding AEP. Then we're going to talk about the different enrollments periods with Medicare, because that's overwhelming and confusing. We're going to talk about what the heck is an ANOC? A knock? Nope. Oh, here come my dogs. A knock. And then we're going to talk about the difference between choosing the right plan. I told you, a knock. We're going to talk about the different plans with Medicare and what you're looking for here at AEP. Come here, guys. It's just me. Hi. And then one other thing. A surprise event that I was thinking about earlier today. So make sure that you're tuning in. Refer this link to your friends who are turning 65, family members. If you're helping somebody, get them involved, get them on this chat, get them involved in the Facebook. Great resources. Let's just every time have a conversation and bring your questions to the table. We're here for you again. Trusted Senior Specialist. My name is Sandra Ford, Senior Compliance Officer. I just love Simply Speaking Medicare. Everybody, I hope you have a great afternoon and the rest of the weekend and the rest of the year. Talk to you soon.